think it's time to get started. It's past 4 o'clock in Copenhagen and Stockholm and Central Europe. Today, the topic is Metabolomix with Graeme, the second last of this series, but we will come with other exciting things for the year 2022 that we are planning right now at the moment. And just for those of you who don't know who I am, I'm Anne-Catherine, co-founder of Nordic Laboratories and DNA Life, and we are here to impact healthcare in regards to functional medicine, nutrigenetics, and we're here to support you in your practice and in your quest in helping other people with functional medicine, nutritional medicine, personal lifestyle medicine, and so on. Lots of nice names for something that's focusing on preventative healthcare and health optimization. So the Metabolomix test you of course can find in your VMS account. Some of you have a Nordic VMS account, some of you have a DNA Life VMS account, so depending on where you are in the world. But it's there and you can look it up and you can find the videos also from today. We will be recording, or we are already recording, and we will send out the recording together with the slides after this, so maybe tomorrow or Monday. And then you can also find it in your VMS account under education. So I have promised our team also to let you know that we are about to send out an email campaign on DNA tests, where if you require or prescribe through any 3 tests, then you get a discount of 25%. And it's really to encourage you to use the DNA tests on more people, also to help more people so that they can get more genetic information about their health and their life. So really we're with this offer, we are hoping that we can impact even more people than what we are impacting right now. So look out in your mailbox. The mail will go out anytime really now, I think. So, and of course, we hope that you will join in that campaign. Anyway, enough from me. Graeme, our head practitioner in Nordic Clinic Stockholm and our head educator this year so far, has prepared a presentation on Metabolomix for you. And actually we will follow up on this Metabolomix webinar in January with one of the Genova representatives as well. So what we feel we need knowledge that we need to have strengthened and so on, we will work on further. So don't panic, you will get more information. But I will pass on the stage to you, Graeme, for now. And remember, ask questions in the chat. And at the end of Graeme's presentation, I will present myself again and bring up some of the questions. And if no questions are there, I might be able to find some questions by myself and ask Graeme, just so that you're entertained a little bit longer.
I'm sure we'll have some questions.
Over to you, Graeme. I'll mute myself.
Can you just allow me to share my screen?
Yes, for sure. Sorry. Let me just find you. There you are. Make co-host. There.
Okay. Is that okay? You can see this. All right. So of course, today we're going to do a basic introduction into the Metabolomix test and go through just some of the key questions here, like when can it be helpful? What can you learn from a test? What are some of the key differences between this and other metabolomic tests that we have in the system? Some results interpretations and treatment strategies that you can use. Of course, the test is quite large, and we can't get through absolutely everything today. That would take many hours. So I'm going to go through one example of a report, and we'll look at those key markers that are low or high on that test, and what I would do with those clinically. So of course, when we look at metabolomics, we're of course really looking at what are called metabolites. So in this test, with it being a urine analysis like the organic acids profiles, of course we're seeing, by measuring these things called metabolites in the urine, what's coming out there, what we're getting a nice window into actually what's going on within the body. And of course, especially with the organic acids test and the metabolomics here, we're mostly looking at indications of nutritional deficiency, but or insufficiency or functional insufficiency. But of course, it also provides a window into other dysfunctions as well. Everything from inborn errors of metabolism to disease, to possible diseases also. So just as I was saying here, I mean, different studies there's of course like genomics, and Catherine talking about some of our DNA analysis before. There's proteomics. But these things that we're primarily looking at in the metabolomics profile called organic acids, they are also found in areas like the blood, but it's particularly our urine where we find them in much higher concentrations. And of course, we've seen tests like the organic acids from Genova be around for many decades now at various levels. And of course, it's just really growing in regards to these organic acid markers and what they mean and what we can do with them. So really an exciting area, and it's a nice area because it doesn't require a blood draw, which affects some patients. So in regards to when would you test, why do this test? Well, of course, overall, a balanced diet, it might not be enough to provide all nutrients. So this test fundamentally identifies key nutrient deficiencies that may be the root cause of chronic disease or symptoms. Of course, as a functional medicine clinic, this is one of the key areas that we're thinking about when patients come through the door, because we know, of course, that nutrition doesn't really get effectively looked at within the standard healthcare system, and it's certainly not effectively tested, mostly done through subjective or, of course, food-based diaries. Big plus with this test is that it provides an easy, non-invasive collection that can be completed at home. And I think one of the key selling points is that it really offers a fantastic, if you like, at a glance information to support you and your patient in regards to the results, the causes and the complications of those nutritional deficiencies. So you get a lot of added extra information with this test in comparison to running, for example, an organic acids report. And I'm going to go through this example to show you where the benefits are. And then you really get a personalized supplementation plan. And of course, I mean, like the other organic acids test, it does provide a great overview of multiple systems at once, including gastrointestinal function. So as I'm going to repeat throughout the presentation, if you want to do a very thorough nutrition evaluation without actually having to have the client or patient go through a blood draw, this is probably, the best test that we have to run clinically, because it's going to kind of fit that gap. Now, where might it be a better clinical choice? So overall, it has more markers than the organics test, 83 compared to 50. Good thing with this test is you can add some genetics to it, things like MTHFR. It does also measure fatty acids in a blood spot. And then there's toxin and nutrient elements that can be added as well. But these are add-on parts to the test. So that's not included in the standard price, but you can add those on. It's a much easier collection than a NutriVal, which requires a serum sample. You're going to get more detailed amino acid evaluation compared to an organics test. And there's much better visuals and support within the test report itself and action points compared to an organics report that you get. Does have oxalate markers, so this is really new, whereas of course it's been the oat test, which is Great Plains, that they've been running the oxalate markers for a longer period of time, but now we can see that, of course, here in this Metabolomix, we can get those oxalate markers as well. Downsides are, well, it's a bit more expensive than an organics test. It's 479 euros compared to 339. Of course, I'm doing prices in euro because that's where I'm based. And then if you want to add these additional tests like fatty acids or genomics or urine elements, then there's an increase in price there. So really, I mean, if you can get a blood draw with your patient, that's realistic. So if you're looking for a test that will collect as much nutritional data as possible, including fatty acids, these urine toxic elements, then you might be probably better by the time you've added these on. It might be better just to go straight to upgrade to the NutriVal test, which is really a fantastic analysis with a lot of information. But the NutriVal is also quite sensitive on time and shipping. So sometimes we also see that test gets rejected, or it has a higher level of rejection due to the tighter shipping requirements. So Metabolomix, much easier to collect, much easier to ship, less problematic. So they're the definite huge benefits over like the NutriVal or the organics below it, if you like. So when clinically we're considering a Metabolomix test, it's great because it gives us a total or many systems analysis at least. We can get a thorough overview of functional nutritional status. We're getting this multiple system picture at once, so we can look at poor or potential poor nutrient levels, oxidative stress, methylation, dysbiosis, absorption, fungal issues. And of course, if you do things like the add-on, you can look at genetics. We get an indication or window into mitochondrial functioning and CoQ10 status, stress, of course, methylation, toxin exposure, oxidative damage, amino acid metabolism. And these tests will even be used in standard healthcare to diagnose inborn errors of metabolism. So organic acid testing is not totally unique to functional medicine. It is used in standard healthcare, but the markers that are used are there's often many more, of course, in this kind of test because it's going to include all those additional factors. Now, if you have a client with any of these symptoms or issues, and of course there are more like autism, for example, is not here, or ADHD, but things like mood disorders, cardiovascular disease, insulin resistance, obesity, malnutrition, maldigestion and malabsorption, cognitive decline, even athletic optimization, or increased nutrient demand in physical trauma or healing. So I used a lot of organic acids testing when I used to work at pain management clinic in London, and because of the demand by things like physical trauma and healing on nutrient status. So it can be a great test in all of these different scenarios, and yeah, even their athletic optimization. So of course, if you're looking, you yourself or your client, if you're looking to perform to your best, then an organic acids and this metabolomic test can be very, very helpful. So when we look at the organic acids, what we're really looking at are a few different things, but it basically, if you like, this is an easy way of presenting it, whereby if we're trying to turn substance A into substance D, then it's got to go through some different processes, which is facilitated by an enzyme. And often what we're looking at in the test is, well, if we're finding a high level of substance A, but we have a very low level of substance B, then there can be a block in this process, which often may be due to a nutrient deficiency like B6 or magnesium, for example. So if we're finding a high level of A in the urine, we know that probably there's nutrient deficiency affecting this enzyme process. So that's how this test primarily works. Now it looks like, of course, the organic acids test. It looks heavily into the citric acid cycle, and of course nutrients and cofactors, they're needed in all steps of energy production. I mean, this is a really nice diagram just highlighting things like how carnitine, B vitamins, we've got then magnesium over this side as well. We have, of course, things that can interfere as well, like heavy metals and how they can block or affect the citric acid cycle. So it's quite a cool test, considering the importance of the mitochondria and how much that is growing in the research literature and our understanding. The fact that we can get a window into that functioning from just a urine analysis is, yeah, it's fantastic. So when we're looking at the results that are coming back, often they're due to 4 different things. So normally there's a problem in any given pathway, because either there's direct nutritional deficiency. So we might see, for example, low amino acid levels that are driven by, for example, a vegan diet. Then we can see pathways that are burdened because of cofactor deficiency. So a nice example, as I've just been through here, in order to turn A into B, we might need something like magnesium or B6 to help to facilitate an enzyme. And if we don't have enough of that cofactor, it's going to affect that process. Then, of course, number 3, we can have a genetic impairment of a pathway. So it can be inborn error of metabolism. Now, often that may be picked up, or most cases picked up by the hospital or the primary care early on, especially for more serious issues. But we can see some genetic impairments that come through the clinic, but that's not so often. Of course, we're mostly looking for options 1, 2, and 4. So it might be a highly burdened pathway, and that could be things like oxidative stress or mental, emotional stress driving something up, for example. Of course, overall in the test, we get mitochondrial markers, we get a window into carbohydrate metabolism, the glycolytic cycle, oxalate markers, bacterial and fungal dysbiosis, detoxification, ketone and fatty acids, neurotransmitters, and oxidative stress. So whatever, like Metabolomix, or whether you go for one of the other organic acids test, you're going to cover a lot of similar things. And if you're in the organics webinar that I ran, I talked through these slides, but the Great Plains oat test, that has the most extensive list of microbial markers, both bacterial and fungal species. It's the only test with a marker for mold. And then but it's got fewer vitamin markers. It doesn't include this 8-hydroxy-2-deoxyguanosine, which is a really nice oxidative stress marker. And then the amino acids are more extensive and include several for inborn errors of metabolism. So you get around 77 markers in this test. So in our system, this is called the OAT test, the organic acids test. Whereas if we we compare that to the organics from Genova, then this is the only test that basically includes well, a much fuller picture of glutathione status and limiters, and it includes 8-hydroxy-2-deoxyguanosine. We get this p-hydroxyphenyl lactate as oxidative stress as well. Little less markers, but of course there's a nice extensive interpretation guide with the reporters as well, or that you can get from our system. So of course, the question always comes up is which test should I choose as a practitioner? So I think if your budget is lower, so if the client or the patient does not want to spend the higher amounts, then if you want to look at some kind of organic acids analysis, you want to go for an organics or an oat test. And the organics has slightly more focus on vitamin markers, oxidative stress, and glutathione function, whereas the oat test has more focus on mold and inborn errors of metabolism and GI imbalances. But then if you want to step up to the next level, if you would like a more in-depth analysis without the trouble of doing a blood draw, then this is, I think, where the metabolomics really fits into the clinical picture. So it's a little bit more expensive, but you're going to get more information without the trouble of going through that blood draw. And of course, if you can get a blood draw, I would say then you want to step up to something like the NutriVal, because then you'll get even a bit further clinical information from that. So a lot of the time in the clinic here in Stockholm, we've run a number of for the organics and the oat tests. And then for those that we want more information, which don't live in Stockholm and we can't get easy access to a blood draw, then we'll go for the Metabolomix. But for those that do live in the Stockholm area, we can easily get a blood draw and they're prepared to do it. Then normally we go up to the NutriVal. So with the basic result interpretation of a report, this is what I really actually quite like with what Genova and how they're changing their visuals and their support. So we can actually see here that we get a nice breakdown of where are the key, based on all the parameters in the report, we get this kind of at a glance first page view to say, well, out of basically a maximal score of 10, of which we can see 8 here on toxic exposure, we've got 7 on mitochondrial dysfunction, and then we've got 4 on oxidative stress and 2 on methylation imbalance. So this really gives us as the practitioners, okay, where do we need to focus our attention? So of course, as I do with all tests, I want to look at the whole report first, and then I'm going to focus on the priority areas, areas first. Of course, the higher the number here, the more focus it's going to need. And then I'm going to consider red flags, although it's a bit harder with an organic acids test to really, efficiently determine red flags. There are certain ones like under certain circumstances, like if the patient is very overweight, if they're obese and they have high levels of alpha and beta hydroxybutyrate, then they could have diabetes, and they may, you know, if you're not a doctor, then you may certainly, well, you want to get them to a doctor to really evaluate, are they diabetic? Do they need more medical intervention at that time? So a few things here, again, like 8-hydroxy-2-deoxyguanosine, then that can be driven high by certain things like cancer, which you need to be aware of. But of course, it can also be driven up by things like just lifestyle and diet, etc. So always, you know, look at the symptoms of the patient, look at their history, take all into consideration. And if you're unsure and you're not a medical doctor, then just ask them to go back to their doctor for further analysis or a consultation, just to cover, you know, your back and do your due diligence. Now, we do have a really good interpretation guide in Nordic VMS. So if you search for Metabolomix here, you'll see on the right-hand side, we've got these PDFs that you can download at any time. So do go there and check for the interpretive guide. It's very helpful, a lot of information in there. The really nice with this test compared to like one of the organic acids analysis is that not only do we get that front page with where we need to focus, but then we get this nutrient need overview. And here we can see, okay, based on this kind of traffic light system, we want to focus, first of all, of course, anything in the red region, and then amber or yellow. And of course, green, we have to worry less about. And it actually gives us the levels or the recommendations that can be used based on the results of the report. So it's really doing a lot of the hard work for us, rather than us having to go away and think about it. It's actually given us a really big helping hand. And then we can even see, like, for example, if we use, which one should we do? I'll just take alpha lipoic acid as an example here. Then it's actually going to tell us with this, you know, the function, the cause of deficiency, complications, and food sources of that nutrient. So we get a lot of like hand holding through the test. So you don't have to spend a lot of extra time, you know, writing this out to patients. It's much more efficient. All the information is there for you. So they've done a really good job with this test. Of course, then it goes into like B vitamin needs and mineral needs as well. So again, working on the traffic light system, again, working on the function, the cause, the complication, and then, of course, the different food sources to help give you that information. And then finally, it has like need for probiotics, need for pancreatic enzymes, and then also functional imbalances, looking at need for methylation support, mitochondrial dysfunction, and of course toxic exposure here. So again, really nice and clear. So when we get to like the first section of the report, so I've just cut out the different sections here, and I'm going to go through this like one by one. So if we look firstly at the dysbiosis markers and malabsorption, the test is very simply, again, each marker is broken into this traffic light system. So you can see where you need to focus here. So generally speaking, anything in the green is not worthy of your attention right now. You want to focus on anything in the red area first and foremost. And then we've got, of course, following up with that, we've got these amber areas. So as we go through these markers, we can see things like here that this phenyl acetic acid is in the amber area, and that's produced by bacterial metabolism of phenylalanine, and several bacterial strains are known to produce this, including Bacteroidetes and Clostridium species. Also, dietary polyphenols, they may elevate this, so you need to be like careful and considerate when you're looking at this test. It might not always be that some of these organic acid elevations are just due to dysfunction. There could be dietary influences. So always make sure that your client avoids those foods the test advises to do before, because you might be thinking, oh, this is a digestive problem, and they just may have had a really high intake of polyphenols, the day before the test, for example. So, but if this is like a true result, and if there wasn't really any polyphenol input on this here, then high levels of this PAA, it suggests that there's incomplete digestion and absorption of this phenylalanine in the intestine, and then it's allowing colonic bacteria to convert this phenylalanine to PAA. So it can reflect overgrowth of bacteria, and of course then you can use basically for things like this digestive enzymes to try and help to improve this situation. You might use like HCl, so betaine hydrochloride. You could also use just like lemon water or things like apple cider vinegar to help stimulate the digestive system, so working more on the cephalic response. So that's, if we have a case like this, again, it's nothing serious here, wouldn't be too worried about it, but we could start to support that area. And depending, of course, on the client, you might decide to go in with some like enzymes and HCl, or you may just start to use something like apple cider vinegar. Now, if we get down to this next section here, so we can see we've got this benzoic acid, which is in the amber area. Again, it can be formed from bacterial metabolism of polyphenols. But again, it can show that there's like elevated levels of bacteria. We've got some dysbiosis occurring, which may need to be treated. So you could use some light broad spectrum herbal therapy, especially if there are like digestive symptoms of dysbiosis in that case. And then as we get further down the report here, we have this what's called citramalic acid, and it's basically it's a yeast metabolite that can be influenced by intake of fruit. So it may be that just your client or patient is excessively consuming fruits, which may not be good for a few different reasons. But it can be, of course, a window into, well, they may have, some kind of yeast overgrowth. So you might want to, of course, consider using some kind of yeast treatment, whether it be something like grapefruit seed extract, or caprylic acid. Again, we don't get a sensitivity report in this analysis, so we don't know what is the best thing to use. You're going to have to either go a bit of trial and error here to see what could, does it help to relieve symptoms? And you're going to have to really put your like detective hat on, your kind of, you get your functional medicine hat, where you're trying to get to the root cause of the problem, and look at, well, what's their food diary like? Could this be driven by fruits, for example? Do they have other indications of yeast or fungal overgrowth? Then you could go maybe straight into some fungal treatments. Or again, this might just clinically say to you that, well, we need to run some further analysis, an actual stool analysis test, to really confirm that that's what we're seeing clinically, and that's what's going on. So again, you've got different levels that you can take this. So overall here, you can see from this this first example, there's a bit of maybe some minor absorption issues. There's a little bit of dysbiosis, but of course the main area to focus would be, is this a yeast issue, or is it just very high intake of fruit or sugars? That may need to be addressed separately, as well as obviously treating for yeast overgrowth. And when we get into the next section here, we're looking at cellular energy and mitochondria. So a whole variety of markers here. So the top two, we've got adipate and subarate, or adipic acid and subric acid. And when these are elevated, it often reflects insufficient carnitine or lack of nutrient cofactors for proper beta oxidation. So that's usually B2. So we might often see this in like vegetarian or vegan patients, of course, because they don't really get carnitine in there, or they shouldn't be getting carnitine in their diets. So usually when we see this, it can be also with things like diabetes. It can be with fasting. So you also need to be aware of things like that. But when we've got high levels of these two metabolites here, basically it can lead to further mitochondrial dysfunction by injuring the cell membrane and then producing free radical damage. So just be aware of that. Then we can also see things like if you're having multiple high markers in this part of the report, then definitely make sure that things like iron deficiency has been ruled out. So again, sometimes in functional medicine we get so much into these very cool tests and details that we often forget to just do some basic analysis. So especially if you're seeing markers down here like this citric acid marker, then you want to check for or rule out that has a recent anemia test that's been done. If we just go back up to the carbohydrate metabolism test here, so again alpha and beta hydroxybutyrate. So we need to be asking questions like, are you on a low carbohydrate diet? If they're not, then you want to be considering this, especially if they're overweight or obese or have got that truncal obesity. Then want to consider, do they have possibly diabetes, or are they becoming insulin resistant, pre-diabetic? Then you certainly may need to be running some more standard blood testing to answer those questions. Now, so it can, of course, also be that things like with high beta hydroxybutyrate, as it's a ketone body, during periods of fasting or like exercise, these are produced or generated in the liver. So you really want to just ask those key questions from your client, like if they're a keen exerciser, they're controlling their carbohydrate intake, then it might be totally normal to just to see that elevated. Now with citrate and cis-isonitate and isocitrate, they can be especially elevated when there's problems with ammonia clearance. So we might need to use something like arginine to help those. So again, we've got another marker further in the test called orotate. So if orotate is also high, then it really is telling us that we need to use arginine to help stimulate the urea cycle. If you see here, there's some elevations going on in these first three, but orotate is not high, then you want to look at the dysbiosis markers and see if there's like any intestinal and microbial overgrowth, because that can also be a source of ammonia, like challenge and renal clearance capacity. And then like malate, fumarate, and alpha ketoglucarate, if any of those are high together, then we definitely can see that, or we can definitely, it definitely tells us that there's some problems going on with inefficient oxidation of NADH. And that's just generally indicating mitochondrial dysfunction, or it could also be excessive supplementation of citrate complex. Like if they're using magnesium citrate, then if the citric acid marker is high here, then you want to double check that as well. And then as we get to the bottom here, like malic acid, so if that's high like it is on this marker, then you can give some NAD support. So the first thing would maybe just try some vitamin B3, magnesium, but you could also try and use a product like NAD plus to help. So overall here, we're really seeing that there's a variety of issues going on just with cellular energy production and the mitochondria. So then we're going to look at all the different nutrients that can affect it, but also things like oxidative stress and glutathione status. We need to rule out basic things like iron deficiency. Don't always go too much into complicated areas first. Make sure you do your basic homework as well and have those things been checked out. And then, of course, we want to try and solve these nutritional deficiencies as well as support the mitochondria in general. And of course, some of the main ways when we've sorted the nutritional deficiencies out, of course, exercise and fasting are two of the best ways to really improve mitochondrial health. So we want to get our patients as fit as they can be. We want to include things like strength training as well. So now if we go to the vitamin mark section, so we can see here that there's nothing really sticking out from this section, but we've got quite a few here which are like borderline kind of green area, verging on amber, some getting a little bit higher up. Now most of the time these are all related to B complex vitamins. So when we see things like this, or we see a pattern like this, then for me it just suggests, well, there's no major problem here, but because we're getting, I'm not just interested in, okay, I want to try and optimize every client or patient as much as possible. So we could use a low level B complex in this case. It might not be that I'm going to supplement with them every day. Maybe it's once a week or twice a week with this kind of pattern, just to push these more into the optimal range. Of course, always we're looking at diet intake first, but if their dietary intake is good, then we're going to use a supplement on top. Or if their dietary intake is not that great, we're of course going to use a supplement short term to help bridge the gap while we can actually have time allowance to basically work on their nutrient status. So then as we get to the neurotransmitter metabolites, we've got a very obvious high result here, kynureninic acid. And the kynurenine pathway is particularly sensitive to vitamin B6 deficiency. And even things like vitamin B2 is also an important vitamin cofactor within the pathway. So yeah, basically, if you see just kynureninic acid elevated, then just go for B6 supplementation. When the quinolinic acid level starts to elevate, then also it can indicate a need for more B3. So in this case, yeah, definitely some B6 supplementation, possibly just putting in a low level B3 supplement to help out in this case. Then when we get to the toxin and detoxification markers, so as we can see here, there's 2 in the red zone, 1 in the borderline, and 1 okay. So this is telling us, well, with this pyroglutamic acid elevation, it can reflect a lack of precursors or nutrient cofactors for glutathione recycling. So it might be that glycine or cysteine, glutamine is just deficient or insufficient, but also magnesium. So one of the most common things to do here, first of all, would be to use glycine and magnesium, but then as oxidative stress in general, it will upregulate the detoxification pathways. Need to look for things like, well, it could just be coming from medication. So again, always take a list of what medication your patients are using, your clients are taking, and we always look especially for nutrient deficiencies associated with those medications. We use things like the Natural Medicines database to help us identify that. Then here we have this next marker. So alpha ketophenyl acetic acid comes from styrene and xylene exposure. So again, these things like you need to look at or look in their environment, or consider things like, yeah, are there any plastics or rubbers or surface coating? So where do they live? What might, are they using any glues? Are they doing that at home? Are they doing that at work? So you've got to ask a lot of background questions. Okay, where are they getting exposure to this? It might be they live next to, I don't know, some kind of factory or some kind of like repair shop that uses these things as part of their everyday work. And that might be managing to, of course, get into their household as well, and they're breathing it in. So you really need to do some digging around that. I've had patients with a whole variety of different things. Either they work with them, or they live by a place that works with them, or they might have a hobby that involves using some of these things. So you've got to dig into the questions there and find out where is this, where is it coming from. But of course, if we have higher levels like this, then it can affect DNA damage. Of course, there's also things like insulin resistance and inflammation that are going to be driven just by these higher levels. Then we've got this MTBE marker, which is high, and it was a gasoline or like petrol additive that was discontinued in the early 2000s. But of course, there's been significant groundwater leakage from things like storage tanks, that this MTBE often exists in groundwater. So when yeah, this is like it is here. Usually it means that there's been a petrol station or some kind of exposure to that nearby, and it's getting into the groundwater. And maybe in some cases these we can have houses that, well, if they're not connected to a standard water supply, they may have like well water that's been compromised. So if you have patients that do live out in the country and they have these their own supply of water, you might need to get that tested. Of course, if it's like this, then I would get the household water tested anyway, just to see where that's coming from, and confirm if it is coming from the water source being delivered through the taps. So next one, when we get into oxalate markers, so this is a new addition. So basically here, of course, we've had more attention with oxalates and over the last few years with practitioners and then clients doing low oxalate diets. So in a case like this, where if this one is this glyceric acid a little bit on this kind of amber or high side, then it can be that there's a lack of B3, because of course the enzyme which helps to kind of keep this low, it requires B3 to work. So the first thing is there enough B3 in the diet? Do you need to supplement that? It can also be elevated from fructose intake. So look at, of course, the patient's consumption of fructose to help to understand where this is coming from. And then if there are multiple elevated markers here, then you could, of course, try things. Well, if you've ruled out things like B3 and fructose in this case, then you could try a low oxalate diet for some of these patients and see if it helps to relieve symptoms. Get to oxidative stress now. So there's no abnormal markers here, but if there was, especially on 8-hydroxy-2-deoxyguanosine, we want to, of course, understand where is that being driven from. It can be endogenous or it can be exogenous. So we've got to look at a whole variety of factors, from things like glucose metabolism, mitochondrial health, internally, but also externally. What are they being exposed to? Is it poor diet or radiation, pollutants, cigarette smoking, etc.? Could be medical drugs. So you've got to do your background homework there. But if these were elevated, then we can, of course, use things like vitamin C, high level, maybe 1,000 to 2,000 milligrams. Of course, there are many different antioxidants that can help. You can use glutathione, but of course, like all of the parts of this test, you've got to do your homework and try and find out where these things are coming from. Now, with the Metabolomix, of course, you're going to get the amino acids, and there's two ways of getting or measuring amino acids. We can do it through plasma, or we can do it in urine. Of course, in this test, it only comes in urine, but if you run the NutriVal test, then you can choose whether you want urine or plasma. And there's some benefits to each different method. So I've just included those here. So if you're really looking for mood disorders, then a plasma amino acid test is probably better to run, or uncontrolled and fluctuating diets, compared to if you have a patient who is on more on a controlled diet. It's better to assess for effects of a recent dietary change. Then, for example, plasma amino acid levels, that they're not influenced by abnormal kidney function. So if your patient has kidney disorder, then it's better to run a plasma test compared to, of course, a urine analysis. But the urine analysis is more ideal for children or adults who don't like to have a blood draw, because it's easily collected at home. And the plasma amino acid, it's more a steady, a reflection of a steady state pool of amino acids. It's not really affected by short-term diet fluctuations, whereas the urine test is. So you need to be aware of that. If the patient's diet is all over the place, they're doing lots of different things, then of course you're going to see more change going on with the urine analysis compared to the plasma. So in this case, so just given an example result here where we can see, yeah, arginine was incredibly low. So the ones here, I've just gone through and I've looked at which are the major ones which fall outside either kind of below or borderline above or significantly elevated. So if we see things like this where arginine is really low, we can increase nuts and seeds if their diet is low in those two foods. Of course, if they can't eat those for whatever reason, then you can supplement, or if they're already eating those things, then you're going to need to supplement to boost that up. Then we've got alanine. We want to look at increasing eggs, meat, lentils, or fish. Cystathione, basically often due to low B6 as well as phosphoserine. So again, low B6. Sarcosine, if it's in this case it's high here, then we want to possibly reduce eggs, legumes, nuts, and meats, and then also increase things like folate, B12, and B2. And then the dietary peptides are quite nice because it just gives us an indication as to what's going on. Is there too low dietary intake of protein or excessive intake? So of course here it can often represent, well, if they're on a vegetarian or vegan diet, we're more likely to see this left-hand presentation. But then we have to think about things like, well, if they're not on a vegetarian vegan diet, why are the levels so low? Is there evidence in the test of malabsorption and digestive issues? So always try and be thinking back about what is driving, what is underlying these clinical issues that you're seeing on the test. So as I've talked about in the various organic acid teachings that I've done, I mean, of course, we can fall into a similar trap when we're going through these reports to just do a this for that type approach. So, okay, this metabolite is low, they need B6 or B3 or magnesium or whatever, and then you can end up putting the client on 6, 7, 8, 9 different supplements. There's not necessarily anything wrong with that, but of course, what we're trying to do is get to the bottom of, okay, ask why are these things low? Is there something like major dysbiosis that is driving things like increased oxidative stress and inflammation and imbalance and uptake issues? Or is it they have a vegetarian or vegan diet that's creating a lot of problems, and you need to try and counterbalance that any way you can. So always be thinking about what is driving these issues here, and how can you get to the bottom of that, just rather than doing a this for that type approach. Because then of course we're just kind of solving maybe some of the nutritional deficiencies, which is of course important in the short term, but medium to long term, we don't really want patients on like long-term supplement use when we can try and improve the quality of their diet or get to the bottom of the problem to solve it there. So I hope that was somewhat helpful. Of course, there's a lot of information, there's a lot of different markers, so it's really not possible to go through the whole test and all the add-ons as well in the time that we have today. But hopefully it's giving you a window into some key markers here, and clinical things you can do and strategies you can use and think about to help your clients when using this report. So I think it's time for some Q&A, and Catherine.
Yeah, I've been busy on the side because people have been writing a lot, but I think I've answered quite a lot. So if there's someone who doesn't feel that, they didn't get a good reply, the answers from me, now it's time to ask to get Graeme's comments as well. Some of the questions were in regards to pattern recognition, the low amino acids that you covered. There's this low amino acid pattern in the urine markers, but if you add on the amino acid markers, you get further support on this as well. What else did we have that came up? I actually got a little bit confused there, because one asked on the, just a second, the hydroxyisobutyric acid, if that's high, and I'm just double checking with you that that's one of the ketone bodies, or is there a marker that looks exactly like the beta hydroxybutyric acid? That was more like what to do.
I need to find this question.
It was, I tried to look up the marker, but I can't copy from Zoom to here. Where was it? Oh, it was after the MTBE. Here it was at 1655.
Okay.
Was my answer. And then let me see where the question was. The question was at 1652.
Okay.
Can you see it?
No,
I think it's a
hydroxyisobutyric acid high.
I think it's a ketone body, and then you want ketone bodies high if you're on a ketogenic, well, not necessarily, but if you're on a keto diet, that's what happens. And of course, if it's diabetes or insulin resistance, then it's an indicator of that, and you need to, if I'm right with that marker.
Yeah. I need to hydroxyisobutyric acid. Okay, yeah, I need to come back to that one in a second.
Okay, we need to come back if we can come back. Otherwise, I'll see if I can look into it for the January webinar. Then you can find, so there's an interpretation guide for this test. So if you log into your Nordic or into your VMS account, find the Metabolomix test, then it's hanging there as a PDF. So have that as a on the side when you cover the results. That will give you information about it. So if we have compared amino acids from blood and urine at the same time, have you done that? I haven't done it myself personally.
No, no, we haven't. Normally we go for one or the other. I mean, again, it just depends on so if we're using the NutriVal, for example, because then we have the option of both, then it depends on how stable their diet is and what we want to answer. So then we'll pick either the plasma or we'll pick the urine option. So I think, again, it's just recognizing with the patient's diet, how stable is it and what do you actually want to get out of that information as to what then to run. But I've not been comparing both.
There's a lot of labs who, so both the Genova lab, but also Doctors Data, they kind of look into both of it. And I believe if I was a lab, I would do internal checkups and then check that it doesn't necessarily correlate, but that that you can use the guidelines that they offer in regards to the urine and the blood. I normally use blood spot because I don't have access to that often access to a phlebotomist, so I use the amino acid blood spot from it used to be from Metabolomix, so that's the one I have most experience with, and the correlation with that and the amino acid markers in organics, I have seen quite often a correlation. Okay, thank you, thank you, Shai. It was the MTBE marker. Thank you. Okay. What to do if it's high was the question. Thank you.
Right. Yeah. Okay. So I think it's a really. I don't have a good solid answer for you, but basically, I mean, I think you've just got to do your best to try and look at the other areas report. Is there evidence of high oxidative stress, and is there mitochondrial damage? You can use, I mean, things like infrared sauna may be helpful. Of course, like supporting glutathione, optimizing nutrition in general, making sure cofactors and all these other elements are available just to support things like, of course, methylation and mitochondrial function. So yeah, I don't have a solid thing, but of course it would be ideally basically getting the county or the council responsible to whoever it is to really look at where that source is coming from, because of course that's got to be addressed primarily. Otherwise you're kind of working very, very difficult, an uphill battle with that one.
And then why only infrared sauna? Any sauna would any sauna use? And then Tanya has already replied that the near infrared sauna is the best because there's low EMF. But if you have a fire sauna, then you wouldn't have EMFs either. And you're still sweating, but would the infrared be better for getting rid of the MTBE? I guess is the question here. I guess it's also if it's like fat soluble, then just sauna and just like water sweating isn't enough. You would maybe have to combine it with niacin and look into protocols as such for sauna.
Yeah, I mean, I think obviously like just sweating and elimination and avoiding things like constipation and doing all those basics are important. I mean, probably taking a sauna of any kind is going to be helpful, but the infrared, I mean, again, I don't know whether I've got like really hard like scientific studies to pull on off the top of my head, but just with how it heats the body in a different way, coming more from an inside out perspective rather than standard saunas heating the air, so it kind of comes from outside in, and potentially, of course, the infrared having more of this kind of healing type effect, just compared to heat. From example, like a coal or wood based sauna. So would you recommend no fasting if it's I don't know if it's a fat soluble toxin? Do you know that? In general, I don't know. Well, I'll take a note to myself for January. So stay tuned for January. We passed the time. I like all the questions that you're getting. I will study them for January. So for now, look out for your emails, because I've had one email on the 25% offer on any 3 DNA tests. And in that mail, you will also find
Karen, a nice picture of Karen, our DNA dietitian. You can book an appointment with her to support you in the interpretation of DNA, not Metabolomix, but DNA. That's the offer that's going out on mail. And of course, this video and the recording from this presentation on Metabolomix that Graeme just did, we will share. It will also be in your VMS account under education, just like all the other webinars that we have been running are there accumulated. So if you get a little bored, you know where to go to. Otherwise, 9th of December, 4 o'clock, is going to be where Graeme covers cardiometabolic panels. So stay tuned for that. And Graeme, as always, a sterling presentation. All people who signed up had stayed with their bum in the seat the whole time. So only at the end, when the Q&As, people started drifting away. So thank you very much, Graeme.
So they all fell asleep and they couldn't sign, and then they woke up towards the Q&A.
Well, there was no repetitive questions, I tell you that, so I don't think they fell asleep. Thank you very much, Graeme. Thank you very much, everyone. Take care and have a lovely evening wherever you are. Bye.
Yeah, thanks. Bye.